Thank you for tuning in to the Let's Get Comfy podcast. I'm your host, Norman Harris, owner and founder of Comfort Measures Consulting. I always say that there's no such thing as a self-made success story. So it's time for me to give a special thank you to many individuals that helped me get to this point. All right. First off, I want to thank all the previous guests that's been on season 1, 2, and 3 for taking time out of their busy schedules to come here in person to shoot their episode and share their story to the community. Thank you so much. Forever grateful. I have to thank my wife and Dr. Judy Johnson. Dr. Judy Johnson shared her location for me to shoot season 1, 2, and 3. So I really appreciate her seeing the vision. My wife was my producer. My kids, many of the guests that came on the show, they actually met my family because that's how I started this journey with them, and they'll still be a part of the journey. So thank you so much to my baby Quishandra Harris, Dr. Quishandra Harris, for giving me an opportunity to chase this vision. Thank you to Corey Crawford being my right hand. If you need any assistance with branding, social media, graphic design, website creation, OTV agency is the place to go to. Special thank you to all the organizations that open the doors and arms to Comfort Measures Consulting and the Let's Get Comfy podcast. My goal is to bring healthcare to the forefront in an edutainment fashion. That's why I proclaim Florida's #1 healthcare edutainment station. A lot of things can be prevented if we have the conversation sooner, if we have the knowledge and actually apply it sooner. And that's what I'm all about with providing knowledge and resources in the healthcare space. So thank you for Florida Healthcare, to FAMDA, to Fladana. Those organizations really allow our broadcasting service to highlight wonderful physicians and medical directors that are doing great work, and director of nursing who have incredibly hard and tiresome jobs, right? Every single day. I come here today just sharing from the bottom of my heart a special thank you to each and every one of you. To Jennifer Eddings and the Call Light Collective, doing amazing on her platform at this time, for also seeing the vision and saying, hey, Norman, I'll give you an opportunity for me to share my story on Comfort Measures Media. She's a part of the fabric. She's a part of the foundation. And I really and truly thank her. So I wanted to take time before we get started with season 3 and episode 1, give a special thank you to each and every one of you. If you have not subscribed already, your subscription matters. Please subscribe on YouTube at Comfort Measures Media. Follow us on Facebook, Instagram, at Comfort Measures Media, or Comfort Measures Consulting, I should say, or Comfort Measures Consulting as well. Thank you again for doing so in advance. Please tune in to all past shows, all past videos, as it truly is knowledge and resources that could be very beneficial to you, or you can share it with someone you may know in need of help. It's another episode of the Let's Get Comfy podcast. I'm your host, Norman Harris. Boy, I have some heavy hitters on the show. Season 3 it's going to be amazing. It's already starting out that way. 2 monumental individuals that's joining the platform. I'm so grateful for this opportunity with CMC Media, the launch of CMC Media, but also the growth of the entire channel, the growth of our media and content. And today, I want to give a special celebration to my 2 special guests. And they said, Norman, you have to have us together. We're funny together. So I say, you know what? It's going to be my first show with 2 guests. So it's different for me as well. So I'm happy to do it.
And maybe your last also.
Oh, no. You know, you may have other people that want to join and want to do it. But at this, I think you guys are going to set the tone. Okay. Set the tone.
Sounds good.
So welcome to the show, Dr. Walter Kittle and the Madam Robin Bleier with RB Health Partners. Thank you so much for joining the show. Thank you. Thank you so much. So glad you joined us and continue with the ritual here with season 3. We always let our guests start them all in a little awkward situation. We let our guests introduce themselves. I always find most healthcare leaders don't feel too comfortable talking about themselves, but I want you all to do it today. Tell us who you are. We'll start with you.
I'm Robin Bleier, and I own and operate RB Health Partners. This year will be 24 years in December. So I feel very fortunate to do that. I get to work with 39 other amazing people, and the secret sauce is them. So I'm very fortunate. It's an interdisciplinary team. We are a national company, but we're probably the most prevalent in the southeastern part of the country. And we work exclusively in long-term care, mostly skilled nursing facilities, some assisted living facilities, or continuing care retirement communities. So we try to help people be in regulatory compliance, look at their systems, processes, and then deal with things from clinical reimbursement to epidemiology to risk management, regulatory compliance, social services, activities, life enrichment, which is so important for the residents, and health information management, Joint Commission accreditation, and a few other things to try to help people do the best they can do.
You said that all without like having any interruptions or anything. We had to do about 7 takes if I had to say all of that.
Well, I've been doing it for 24 years.
Thank you, honestly. Thank you. That's amazing. But yes, welcome to the show once again.
Thank you.
You, sir?
Well, you expect me to follow that?
I know, right?
I should have gone first.
Yeah.
Oh, gee, well, I don't have much. Well, I'm Dr. Walter Kittle, and I guess I've always been split on what I like to do. I really love science. I really love music, and so I kind of go back and forth. So I actually started out as a music performance major in college on a full ride scholarship. And after a couple of years, I figured out that I probably wouldn't get a job. So then I switched to biochemistry. Then I got my doctorate in chiropractic and summa cum laude with highest honors. And then I did 2 additional years with a board certification in sports medicine and rehab. And then about, how long has it been? How old am I? About 10 years ago, I retired. And of course, I went back into my first love, which is music. And now I'm an international recording artist with 5 songs on the top 100 in the nation, on the Billboard charts, and starting to do festivals. And most of it's because of this person right here, because she backs me and supports me. And we're a great team. We really
Yes, sir.
are.
Yes, sir. As I stated before, 2 monuments here with us today. So wonderful. You share with me just how you toured all over the world with your music as well. It's obvious that life actually connected you back with your passion, which was music. So that's really good. But I want to talk about the love story. So we're going to start off there. Little drama here, but no. So how did you pursue Ms. Bleier?
Well, I was tenacious. I had to stick to it because she's a hard person to date. There were stories about her actually leaving her dates at the restaurant and leaving them there on multiple occasions.
Wow.
We were both on this dating website.
Just a couple times.
We're
Only
on
a
this
couple
dating
times.
website, and I hear all these stories. She would go out, didn't like them, she'd sneak out the back.
Only twice.
Yeah.
No, but now is that after? If that you just wow.
So I'm telling you, I went through some vetting. I tell you, I just stuck to it. Well, first of all, you did a background check on me. Then she got my credit score from a friend where I bought a car.
Whoa.
Then she tricked me into taking this personality profile, the dish thing. And I'm lucky I survived. So I think the secret was I just hung in there where all other people, they quit. They couldn't take it. I just stood in there and I was very tenacious and I hung on and finally she gave up.
Wow.
I was just exhausted. This is a lot of drama.
Wow. So let me ask you, does that research, did you get that from like a military background, like family or anyone?
No, but I'm a healthcare risk manager.
She's
So
a risk
man.
manager. She knows how to do this stuff.
You did it too.
I can't get away with anything.
Yeah, you say you don't even try. Huh? Don't even try. You're right. So in short, why Dr. Kittle?
I think originally I found him interesting. He, on his dating profile, said he was a bass guitarist, which I believed him that he was. But then when we sat there and had some conversation, I felt that there was probably a little more to that story. So I'm an investigator. I had to find that out.
Yeah, you investigated all right.
Yeah.
Yeah, you did.
It wasn't exactly the way he
So let me
said.
ask you, when did you actually tell him all of this? Like all the research that you did? Like how did you discover that she did all of that research on you?
She tricked me into it.
I did not.
Well, the credit score I didn't find out till later,
Mm-hmm.
and the
that you should
security
have
check,
known first.
I didn't find out till later, but she tricked me into doing the personality thing because I told her I was such a traditional individual, and she goes, "No, you're not. I'm going to prove it. Let's take this little test here."
Wow. She probably did like a hair sample when you guys were
Oh,
out
yeah,
that day.
DNA.
All that kind of DNA.
You know, a
Oh,
girl
yeah.
cannot be too careful nowadays.
Wow.
I was divorced and single for a long time. Girl
Okay.
has to be careful.
And actually, her friends, when we got married, they said, "What did you do to her? Did you hypnotize her or drug her?" She said she would never get married. What did you do to her?
But you get it, Dr.
I
Kittle.
just stuck to it.
Right. We will call
I
you
wore
Hitch.
down. I wore down.
Yeah, you did. I mean, I mean, you really saw something there, man. That's you went a difficult route. I'll say it sounds like it to me,
It's been worth it.
but it's
though.
been worth it.
It's
though.
been worth it.
There you go. Been worth it. So one thing I asked, I had to get permission to ask this question, but I wanted to ask. I said, why not Kittle? Why didn't you go with Kittle? The last
name?
Yeah, I want to know that decision.
Because I own RB Health Partners.
Okay,
and
That'd
it's,
be RK Health Partners.
There you go.
you know how much money it costs to rebrand?
Well, no,
and
seriously,
all the time
though.
to change all your credit cards and everything?
Oh,
gosh.
seriously, she has worked for many years to get her reputation.
Mhm.
And I thought, no, if we go with a different name, no, you work too hard for it. I said, it's not necessary.
Socially, people call me Kittle, but
Really? Okay. I like the understanding that you displayed, for sure, because you knew that she built something, great, and that she was on the verge of doing wonderful things. Because how many years again it's been?
we
24.
met.
Us.
RB Health Partners 24 in December. We
Okay.
met in October of 2018.
2018. Well, wonderful. Well, I also want to start there because you guys joined the show to share your story and how you sort of met, but just give that additional details about you two. But you also started out in healthcare as well. So if you would tell us about your connection with chirotechnology and what's that all about?
Well, as I said, I always liked both science and music, and I always liked to help people. And so I picked the field of chiropractic because you could really help people with that. And I combined that with my science so that actually the term chirotechnology is a term that I coined because back when dinosaurs roamed the earth, when I was first in practice, there was a big divide in physical medicine. There were the chiropractors that only did bone and joint, and then there were your PT people, they only did muscle. And I'm going, it's both. So I actually came up with a system that dealt with both restore the joint movement, then get the musculature balanced. I was the first person in the state of Michigan to employ a massage therapist in my office because my thought was, well, if you have a tight muscle and I mobilize the joint and it's still tight, it's going to pull it right back out of place. So I actually hired massage therapists and took a beating for it. I had colleagues actually turn me into the board, wanted to take away my license because I had a massage therapist. It was actually a fight. And now everybody has it, but at the time it was quite the thing. And then I also incorporated it into the central nervous system. So I don't picture myself just as a chiropractor. I picture myself as a healer, and I like to glean from all of the disciplines and put them together so that the patient gets the best care.
Yes. So you understand the value of manipulation too, of muscles and ligaments as well.
Right.
That's really good. And that's forward thinking that you was the only one in the state at the time to bring that to the table.
Yeah.
But do you know why? Like they were, I guess, threatened by it at all?
My personal feeling was they were jealous.
They was jealous.
But I don't know.
That's good, man. So that's really good. So do you all consider yourselves entrepreneurs? Both of you. That question is for both.
Yes.
Yes. Okay.
I don't think so, actually. I consider I'm a humanitarian, actually. I like to help people. So my impetus, what I wanted to do was help people. Mm-hmm. Now, I did gain financially very well. In fact, at one time we had a company we were working with, and they said that after research, we were one of the top 5% in the nation as far as, services and money collected. But that wasn't my goal. My goal was help people and say, if I helped you, tell your friend. Didn't advertise, lived in this little tiny town, and then yet we were the top 5% in the nation.
Wow.
But I'm kind of like what the Bible says. You give, it's given unto you. So
Yes,
that's my impetus. I don't really think of an entrepreneur, though.
I like it. That's a great response. Well, I will say, even to today, one of the best ways to increase sales is word of mouth. Referral partners is always
yeah.
key.
It really
for
is.
Oh, I agree with that completely. We like to, at RB Health Partners, we kind of originally voted on kind of like where we gave our monies. We don't do vendor tables, not that there's anything the matter with it, and thankfully many people do. But what we rather do is we make donations to the PAC. We make donations to like the education building that was built at Florida Healthcare and other things of that nature. And, scholarship funds for nurse leadership. We sponsor the awards for nurse leadership for the CNA of the year, the LPN of the year, the RN of the year, all those, to try to encourage people to do more for themselves. The better they are, then the better their community is. So our kind of thing is we are entrepreneurial at RB Health Partners, but we tithe a percentage of our earnings to help others.
To help others, yes. So connecting that, that's a very unique story that you guys kind of shared already. But if you can share with me, what is you say most unique about your marriage, but also how do you balance love and business as well? So that's a two-part question.
Well, one thing that's unique is we both played the bassoon. And we both like anchovies on our pizza.
Oh. So
No, but I
pizza
think
often?
Not as much as we would like.
Okay.
But I think what's unique is that we both have our own careers and we're both very dedicated to that, but we support each other's career and work together. It's not like a competition. It's what can I do to help you? What can I do to help you? It's just, I think that's what's really unique. We're both could do well on our own, but we do better together.
Better together. That's beautiful. Yeah.
I can't add to that. That's perfect.
That's nice.
Good job, honey.
Hey friends, Jennifer Eddings here, the heart behind the Call Light Collective. I created this space for you. I created this space for me. I created this space for all of us. This is a space that is designed for us to come in and speak about the things that are heavy. For anyone that is navigating a difficult situation, for anyone that has found themselves standing in the middle of life just looking for the light. Around here, we talk about the things that aren't easy to talk about. We talk about the things that people typically are quiet about or whisper about. We talk about the things that literally can set someone free once they know that they're not the only one going through it. So this is my ask of you. I want you to be just as much of this movement as I am and the women that have sat in these chairs before you. I would love for you to share your story with me. Write to me, tell me what you're going through. Share a situation that you've been navigating through and you just would love some outside perspective on. Or if you just really need to know that you're not alone. You can email me at comeformeasures24@gmail.com. I would love to hear from you. Whenever you need something or you need someone to be there for you, I beg of you just to hit the call light, and I promise I'll answer. Because at the end of the day, all of us are just walking each other home, one conversation at a time.
All right. RB Health Partners. Okay, so you created a wonderful organization, right? If you can tell me the origins of RB Health Partner and what's one founding principle that you've kept since day one.
Well, our principle is always about helping other people. So we think good care is productive, and that's important. And obviously, the good care doesn't just extend to the residents, although they're number one, but also the people that work there. Yeah. So it's important that, there's a culture of caring. And so we have that at RB Health Partners, and we have long tenure. We have staff that have been with us for, other than a few people that unfortunately passed away, we have people that have been with us, I think the longest is 16 years. Wow. But we have a lot of people that fall between, say, 8 and 12 years. So tenure is one of the things that helps to monitor that. But I think it's great that all our team, they're all different. Each person is truly a unique, different individual, but they all support each other. They're all caring of each other. Some are friends, some are not. Sometimes you make great friends at work, as you know,
Yeah.
but not everybody does, and or not everyone's your friend. In a group of 40, obviously, everyone's not going to be everyone's friend, but everyone respects and admires. And then the other part of that is I try not to create competition. We don't have Employee of the Month or Employee of the Quarter. There's not a special award at the end of the year. There's no President's Choice, because honestly, we are all also better together is our work theme at RB Health Partners. And if one person doesn't succeed, then we don't succeed. So at one meeting that I held one year, I bought mirrors for everybody that came, like a mirror that a gentleman might put in their bag or a lady might put in their purse. And I said, look at that mirror and look at yourself. Now look to your left and look to your right, because everybody is everybody. You should be seeing everyone's face.
Yes.
So that's important. So it's not about being an individual, even though they are individuals and they're all amazing, because they are, but it's also about how to support each other. So if they're out in the field, they should never feel alone. So like, for instance, I was at a facility in Asheville, North Carolina a couple of weeks ago, and I had an infection prevention control question. I did know the answer. AC Burke, our vice president of healthcare quality, had already previously educated me on the topic, and I felt comfortable. But the client was a little bit iffy. So I said, would you mind if I called AC? And I picked up the phone and I called her, and then she explained it to them. And so they knew she was an infectious disease expert. So it wasn't like this nurse risk manager consultant's just telling me everything. I was able to pull it in. If someone had a clinical reimbursement analytics question, just like at the training here, Katie Sleer is going to be co-presenting with me on some topics that she's by far more expertise than I am now. So, we look at all of our team members to, what they can give and support.
Yes. That's one thing I always believe as well. And I see that in the really good leaders, obviously. Put people around you that can benefit the mission and benefit the vision as well. But you don't have to be the smartest person in the room.
No,
and you don't want to be
not.
the smartest person in the room. But just going back to something that you mentioned, it triggered a question for me. In regards to continuity, one thing I always say in long-term care in a lot of facilities is having that continuity between your facility leaders. With that changing so much, do you think that impacts, what are the aspects you think it impacts in skilled nursing? Just not having that continuous continuity.
Well, I think that we were heading in a certain direction, but then when the pandemic hit in, 2020 in March, that really kind of, made a dramatic impact.
Yes.
Not just the turnover of the direct care staff, which is very important because, if you were a nursing home patient, how many people would you like to see you naked? Think of it that way.
Exactly.
Today it's somebody else. Tomorrow it's another person. Then it's another person. I don't necessarily think people like that.
No.
But the leadership turnover. I have a client the other day, I was talking with them and we're preparing for a conversation with CMS. And I said, well, let's talk about some of the hard questions you're going to get asked for. In the short period of time that I've been with you, I've met 4 administrators, 4 directors of nursing, and 3 corporate VPs of clinical services. They're probably going to ask you, in the last 3 years, how many administrators has the building had? How many director of nursing has the building had? And then they're going to look through the last 3 years of the citations, the tracking and trending, and ask, do you think that the change in leadership has any impact on that? And of course, the answer is yes. So, it's hard. It's not a slight to some people. There are some people very dedicated and and they're doing a very good job, and that's wonderful. But the challenge is that new leadership brings, new policies, new procedures, new processes. Even if someone works for a large company and they have, policies that are pre-established, it's still the implementation of them. So, if you were an employee, like sometimes there'll be a facility where you just meet this superstar who's been there for 20 years of their life and they're so dedicated to the residents and it's beautiful to see. And they'll talk about the impact of, the 17 administrators they've gotten to work with.
Yeah.
And it's, a little bit breaks my heart, to see them have to struggle that way.
Right. That is very honest. I used to be a former administrator myself. It's a lot of facilities that when I took over, CNAs and nurses would tell me they never even met an administrator before. And that was shocking to understand as well. But thank you for sharing that. I would like to ask you as well, what are 2 trends that you've noticed in long-term care that you think could use improvement?
We don't spend enough time training and educating people and validating their competency. And I think if we could spend more time to do that, then people would have more confidence. But to be honest, that's kind of like an unfunded mandate. So, you can't, you can only do what you get paid for.
You're very true.
And
Yes.
there are only so many hours in a day. So I don't say that lightly. So I think that that's an area that I would love to see more support for. And then also, more leadership training.
Yes.
A director of nursing in particular, you go to school to be a nurse. You do not go to school to be a director of nursing. An administrator gets a license in being an administrator.
That's true.
And presumably education and training guides that, at least to some degree.
I never thought about it like that.
But a DO, when I was a director of nursing, so I've been a CNA, I was an LPN, I became an RN, and I was a director of nursing, and I loved that job, and it was a great job. I really did. But, it was kind of probably like being a parent. You don't get a little manual when you get the kid. Well, you know what? When you become a director of nursing, every building's different. Everyone's style is different. But I went to school to be a nurse, not a director of nursing of a nursing home.
Right.
So, there's those things to consider, and that's why training's so important.
Yes, it is very important. And just going down, you've touched on almost every level in the nursing area as well. And I noticed something in your introduction. You indicated you started as a candy striper?
I was a candy striper.
Can you please inform me? I didn't look it up purposefully, so you can tell me so I can look.
Well, I'm a little older than you. So a long time ago, the hospitals had a role called a candy striper, and they were volunteers I think I was 14, and you wore a cute little red and white pinafore uniform.
Really
That's enough. And, you'd answer call bells in the hospital and, assist the nurses on the floor, go get ice water, do things. And it was probably a way to also kind of encourage people to see if maybe a career in healthcare was appealing to them.
Oh, okay.
At the time, my father's best friend was the medical director of the hospital. So I think I just went because I got told to. But I always wanted to be a nurse my whole life.
Whole life. Okay. Well, that's good that you knew that, because I really didn't know. I knew I wanted to be a business owner probably at that time. But thank you for sharing. I thought that was very unique because that's the first time I've seen that. So
it's because you're young.
Oh man. So your approach when when a facility or organization comes to you for assistance, if you could take me through just your first step with evaluating facilities in that state, and make a call. Hey, Robin, we have a facility down in Vero Beach, let's say, and we could use your assistance. What's your first step?
Well, I like to listen to their story.
Okay.
It's important to have them explain their situation, and that also helps you for when you do research to gather how much of their situation they understand. Sometimes they're brand new, and in their defense, they really don't know the history because they're brand new. Then I do regulatory review. We look at, the last 3 years of surveys and things of that nature, so that we can see what the trends are, because facilities have cultures even when the leaders change. The culture does not until someone works to change it.
It takes time too to do that.
It does take time and commitment to that.
Yeah.
And so we try to look at the culture, and then we, interview and talk to the staff, go to the employee break room and look at the building and see how it looks like, what's happening in the building that's for employee morale. Do they have a family meeting? We're required to have a resident council meeting, as you know.
Yes.
We're not required to have a family meeting, but wouldn't it be fun to have that meeting to solicit people's feedback before they complain? Right. So we just kind of look at that, look and see what kind of grievance program they have. Grievance programs are super important. If a resident...
Sorry to interject here. I think you did a session on grievance process as well.
I have.
Yes.
Yeah, grievances are very important, because if you don't ask people, then they'll find a way to tell. But they might not tell you. They might call the state, or they might complain, and that's why people's census maybe is declining. It might be that they tell people in a not good way. People like to share. They just share all differently. Yes. So, but I think grievances are important because it also tells you what the aptitude is of trying to solve problems.
That is true.
And again, there's a lot of unique things about facilities. Sometimes people would love to do a better job at that, but they don't have the resources. So you have to look at that. It could be the systematic process. For instance, I had a facility recently where The grievance program doesn't have a component missing was the written resolution in FTAG 585. You're supposed to have the ability to give a written resolution, and there's 7 things that have to be included per the guidelines, but they didn't actually have that. So that would be an example of, and they were nice people, they just didn't have the tool to do it. So sometimes it's resources, sometimes it's time, sometimes it's understanding. So we try to just understand their situation, not judge it, because it's not easy. I've been, from the CNA on up, and I've also worked as a chief operating officer for 9 years of my career. So I understand from different jobs and perspectives that sometimes it's not as easy as it looks.
Right.
And I never want to judge somebody because it could have been me. We just want to help them. Our goal is to help people.
Yes. Dr. Kittle, I'll shift it to you now, sir. So how did you merge your passion for healing in entertainment? Was it a complete switch for you, or it was just...
Well, it was forced upon me, actually. I sustained a severe back injury, and I could no longer work. And actually, I was quite severe. I couldn't even dress myself or couldn't shower. I was quite bad with some paralysis in the legs, and so I could no longer do that. And kind of an epiphany was, I can still heal with music. And actually, it's really interesting when you get into the new field of music and frequency. That's the new thing coming right now in healing, is using music and frequencies to actually heal. They've actually documented clinically that certain songs or certain frequencies actually destroy cancer cells. It's phenomenal new field that's opening up. And so I still feel that I'm a healer. I just switched modalities. I'm healing through music.
Healing through music. And so for me, hospice was my introduction to music therapy with accent care.
Right.
So I was like, when onboarding, you go and you follow different sectors within accent care. So I shadowed music therapy for a week, and it was just life-changing, like just to see the responses from the patients, that are maybe non-responsive, may not be cognitively intact at the time, but they respond to music in a different way.
Well, I have an
tapping
example.
of the toe, but it's a really brilliant thing to see. And then understanding, like, I didn't even know that was a field of study like that. People can go to school for it as well. So I have to look up some of my old accent care music therapists. I'm tagging them in this as well, but that was probably
it's a wonderful field. It's expanding. I know we're short on time here, but I had a great example of that. A friend of mine was a guitarist. His father was a professional guitarist, and he had dementia. He was in a long-term care. Couldn't remember his son, his name, or anything. He brought his guitar in, put it in his hands. He played it, and then said, "Oh, son, what are you doing here?" He completely came out of it. It's just an example of what the power of music. So it's just going to go for the microphone this time, or do you run that?
You said you want to connect to his mic, right?
It'll record right into the camera, so you can go ahead and play.
Okay, so now do it direct. Okay.
Okay.
As we go into season 3, I have to give a special thank you to Dr. Walter Kittle and Robin Bleier for being our first episode. RBH Health Partners is a monumental factor in long-term care in the consulting space. They really help out facilities with their compliance and educations. And truly, they call it Bleier when you're on fire almost. It's almost like a coined phrase. But I encourage organizations and ownerships to utilize RBH Health Partners prior to, right? What about being proactive with helping structure your clinical strategies, clinical outcomes, so that your facility, but also your staff are in a great position when it comes to taking care of our most vulnerable population. So thank you, Robin Bleier. We actually filmed your episode back in July at Florida Healthcare. You and Dr. Kittle invited me to your suite, which is your private setting to actually shoot. And I really thank you because you was always a guest I always wanted on the show. I called you to the healthcare musical Lovebirds. And so thank you all for tuning in. Again, be sure to like, comment, and subscribe. Continue to engage and help grow in the platform. From the bottom of my heart and from Comfort Measures Consulting, Norman Harris. Thank you forever.